Hey everyone, welcome back to Mastering Nursing. Today we are breaking down a super important topic, heart failure. If you've ever been confused about left-sided versus right-sided heart failure, what causes it, or how to remember the key symptoms and nursing intervention, well, this video is for you. I'll make it simple with easy memory tricks, so grab your notes, hit that like button, and let's get started. Alright, let's start with the basic. What exactly is heart failure? Heart failure happens when the heart can't pump blood effectively to meet the body's needs. So imagine if your heart has a pump, right? If it gets weak or too stiff, it struggles to push blood forward, causing a backup of fluid in the lung or body. So there's two types of heart failure. We have the left-sided heart failure. Left, think lungs, right? Blood backs up in the lungs. Right-sided heart failure, right, think the rest of the body, right? Blood backs up into the body. So legs, belly, everywhere else, but not the lungs, right? So there are two main types based on how the heart pumps. We have systolic heart failure. So here the heart is so weak and can't pump blood well. So we see a reduced ejection fraction. Then we have diastolic heart failure. Heart is stiff and can't fill properly. So we have preserved ejection fraction. What causes heart failure? Well, think of the main enemies of the heart. And in case you don't know, I have a memory trick for you here. Heart fail. So H will be for hypertension, right? High blood pressure overworks the heart. E will be for enlarged heart from previous heart attack, so MI, which weakened the muscle, right? A will be for arrhythmia, so irregular heartbeat, reduced pumping efficiency. R will be for renal failure. Fluid overload makes the heart work harder. T will be for toxins, alcohol, drugs, right, which damage heart muscle. F will be for faulty valve, so blood flows backward, increasing strain. A will be for anemia and steroid issues, which change heart workload. I will be for infection, myocarditis, endocarditis, damage heart muscle. L will be for lung disease, so COPD, pulmonary hypertension, increases pressure on the heart. Now, remember the memory tricks, heart fail. These are the most common causes of heart failure. Now, let's talk about symptoms. The symptoms depend on which side of the heart is failing. Left-sided heart failure, if you remember, we say L, think of lungs. So blood backs up into the lungs, causing pulmonary congestion, so fluid in the lungs, crackles or wells when hospitating, dyspnea or shortness of breath, orthopnea, difficulty breathing while laying down, pink frothy sputum, severe cases of pulmonary edema, nocturnal dyspnea, which is waking up gasping for air. Well, memory tricks here is drowning in fluid. For left-sided heart failure, remember drowning in fluid, right? Dyspnea, wells or crackles, right? Or orthopnea, W will be for weakness, and for nocturnal dyspnea, I for increased heart rate, and for nagging cough, right? Frothy pink sputum. And G will be for gaining weight from fluid retention. Right-sided heart failure, R, remember, rest of the body. Blood backs up into the body, causing peripheral edema, right? Swollen legs and ankles. JVD, jugular vein distension. Waken from fluid overload. Ascites, which is fluid buildup in the abdomen. Hepatomegaly, which is enlarged liver. Memory tricks here for right-sided heart failure. Remember swelling, right? S for swelling in the legs and hands. W for waking. E for edema. L for large neck vein, so JVD. Then we have L for lethargic, so the patient will be tired, right? And then we have I for irregular heartbeat, N for nausea, and G for nerve increase. Nursing intervention. As nurses, what can we do to help patients with heart failure? Well, remember MAD dog, right? M will be for monitoring weight daily. So here we're watching for sudden gain, which equal to fluid retention. A will be for assess for swelling and lung sound. D for diet low in sodium and fluid restriction. D for diuretic. So this patient is gonna be on Lasix or furosemide to remove extra fluid. R for oxygen if needed. G for give medication as prescribed. So MAD dog. And the most common medication for patients with heart failure are diuretics, so which remove excess fluid, like Lasix, ACE inhibitor and imperials, which lower blood pressure and reduce strain on the heart. We can do beta blocker as well, and in NOL, right? Slow down the heart to reduce workload. And then we have digoxin, which helps the heart pump stronger, but watch for toxicity. All right, let's do a quick recap. Heart failure happens when the heart can't pump effectively, causing fluid backup in the lungs, left-sided, or body, right-sided. What's the cause of heart failure? Well, hypertension, heart attack, arrhythmia, renal failure, and more. And what symptoms are we gonna see in this patient? Well, if it's left side, remember drowning, right? Lungs filled with fluid. So those symptoms mostly gonna affect the lungs. Then right-sided, think swelling. The fluid builds up in the body, so rest of the body. And as nursing, and what nursing intervention can you do? Remember MAD dog. So monitor weight, assess edema, diet, diuretic, oxygen, and give meds as prescribed. Now you have a simple way to remember everything about heart failure. Well, that's a wrap on heart failure. If this helped, don't forget to like, subscribe, and comment if you have any question. Also, check out my nursing school study guide, the best nursing school study companion with over 120 memory tricks for nursing students, LPNs, and RNs. Until next time, happy studying!